This will be the application of Chloraprep, which is a good alternative for our surgeons who like to use DuraPrep, but for our patients that have an iodine allergy. Remember, the active ingredient in Chloraprep is going to be the chlorhexidine gluconate with the alcohol. So we like the alcohol because it's the quick kill, kills on contact, and then instead of having the iodine like the DuraPrep does, it has the hibiclins or the chlorhexidine gluconate, which is going to be effective throughout the case. It will be applied a little bit differently than the DuraPrep though. It does come tinted either highlight orange or teal, depending on which one. They're both exactly the same. They're just tinted two different colors because hibiclins is normally clear. So it's going to be tinted a color so that we can see the area that's been prepped, so that we know that all the area has been prepped. They do come in two different sizes, this larger size and then also this smaller size. Most commonly we use this larger size, but if you had missed an area or you have a really small area that you're going to prep, you could open the smaller size as well. They are highly flammable, just like the DuraPrep, because they do have that alcohol in them, so we do need to take the same precautions with them as we do with the DuraPrep. Packaged exactly the same as the DuraPrep. Again, since we're not going to be actually touching the prepped area, we don't have to wear sterile gloves when applying them and utilizing the applicator. They could be opened to you sterilely, making sure that you don't touch the laminated edge. A lot of times people will wear exam gloves when applying them, but you don't have to wear the sterile gloves. Make sure when you open them that you do not allow the laminated edge to touch the applicator sponge. Okay, so you're gonna open that up and then go ahead and pull the applicator out of the packaging, making sure also that you don't allow the cotton tip applicators to touch the laminated edge as well. So you're going to push down this trigger here at the top that's going to break the vial on the inside of the applicator. You can see the agent start to run down and saturate the sponge. So you can see it start to saturate the sponge here. You're going to pick up your cotton tip applicators, again making sure that you don't touch the tip. For an abdomen, we're going to prep the umbilicus first. So you want to squeeze some of your agent out into the umbilicus, saturate your cotton tip applicators, and prep the umbilicus. Now remember, just like with DuraPrep, anything that's saturated with the agent needs to be removed from the room after we've applied the prep. So put it back into the packaging so we can take it out of the room. Don't throw it away in the trash. All right, now the difference between Chloraprep and DuraPrep is that it's more of a scrub than just a paint. And remember that there's two different applications for different types of wounds. For dry areas like an abdomen, we're going to apply the prep with a back and forth scrubbing motion for 30 seconds. For moist areas like an inguinal fold or an axilla, it's going to be a back and forth scrub motion for 2 minutes. So it's not just a paint on like a DuraPrep, it's a back and forth scrub motion like this, where you're actually taking and scrubbing on the Chloraprep. So again though, just like with every other prep, we start at the incision site. You're going to spend the most time at the incision site because that's the area where we need the most amount of microbes to be removed. And then you're going to start to work your way out to the periphery. So this is an abdomen, so my prep needs to last 30 seconds. And I need to work my way outward towards that periphery. Again, if you missed something, once you've gotten outward towards the periphery that was closer up to the incision site, make sure you open a new applicator sponge because you can't come back once you've gotten outward towards those contaminated areas. Remember, it's a scrubbing, it's a back and forth motion, it's not just a painted on like it is with the DuraPrep. Once you've covered your entire area and your time has lapsed, depending on if it's a dry area or if it's a moist area, you're going to take the applicator sponge and any linen or prep pads that have been soaked by the agent and remove them from the room. Just like with DuraPrep, you need to wait a minimum of 3 minutes prior to applying the drapes. And again, it's going to turn from a shiny appearance to a dull appearance. If it's still shiny after 3 minutes, wait longer prior to applying the drapes because as long as it's still wet, it's still flammable. It can take up to 3 minutes on hairless skin just as a minimum to dry, and then up to an hour in hair to dry. So again, remember, try to not get it in hair because wet hair is still flammable.